Welcome to our second worksheet on Reading Part B. Thanks for your ongoing support. This video contains 6 Part B questions and you'll have 2 minutes to read each one. After the 2 minutes, we'll go through the answers together with clear explanations. Enjoy and happy studying. According to the notice, the course is only available to nurses who are already employed in a related field. The hearted section of the paragraph reads, the E&P minor injury course structure has recently been changed. There will no longer be an additional clinical placement. And course applicants will therefore be required to complete all their clinical competencies in their own clinical setting with a designated mentor with whom we will correspond in advance of the course. Therefore, only applications from registered nurses working in a nursing role on a permanent basis in a relevant area such as the emergency department or minor injuries unit within their organisation can be considered, and their place will need to be funded by their organisation rather than self-funded. So the correct answer is option C. Let us read the first bullet point. All inpatient areas that care for infants of expressing or breastfeeding mothers have been allocated electric breast pumps. These should stay on their allocated ward except for when they are being cleaned. They are exclusively for use in the infant's ward area and should not be given to parents to take to their own accommodation. Therefore, the correct answer is A. Restricts their removal from the ward.
According to the policy, what must the registered nurse do when a patient is discharged?
The correct answer for this question is B. Liaise with other health professionals. The question asks, what must a registered nurse do when a patient is being discharged? The highlighted section of the paragraph, registered nurses will have the responsibility for ensuring advice on discharge is provided to patients and, if required, relevant onward referrals are made, including the booking of future outpatient appointments. The registered nurse must ensure that all relevant documentation is complete and accurate.
If you read the paragraph, you will notice that it contains information about the precautions that a health professional must take during inserting a nasogastric tube. Let us read the paragraph together. By inserting a nasogastric tube, you are gaining access to the stomach and its contents. This enables you to drain gastric contents, decompress the stomach, obtain a specimen of the gastric contents, or introduce a passage into the GI tract. This will allow you to treat gastric immobility and bowel obstruction and permit drainage in drug overdosage or poisoning. NG tubes can be used to aid in the prevention of vomiting and aspiration and for assessment of GI bleeding. They can also be used for enteral feeding initially. The potential for contact with a patient's blood or body fluids while starting an NG is present and increases with the inexperience of the operator. Gloves must be worn while starting an NG. And if the risk of vomiting is high, the operator should consider face and eye protection as well as a gown. Quote, in this policy extract, what point is made about clinical guidelines? The correct answer to this question is B. They are a set of recommendations rather than regulations. Now let us read the paragraph together. The development, introduction, and use of guidelines is intended to ensure consistent care to all patients and reduce risks of errors and incidents through ensuring the whole clinical team is working in an informed, consistent, and clearly understood way. The policy aims to ensure that clinical guidelines are developed and agreed, keeping all key staff involved and informed, as well as reflecting best practice. It is important to recognize that clinical guidelines are not mandatory and are not a substitute for clinical judgment. However, where guidelines are not followed, clinicians should be able to account for why a decision not to adhere to them has been taken. In these situations, it is good practice to record this in the patient notes. Clinicians also have a responsibility to report these instances to those responsible for producing the guidelines in order that such instances can be reflected more accurately within them.